Antisocial personality disorder, ASPD, is a chronic mental condition characterized by patterns of disregarding or violating the rights of others. The diagnostic criteria for ASPD, as outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, are as follows. A. Pervasive pattern of disregard for and violation of the rights of others, occurring since age 15 years, as indicated by 3 or more of the following. Failure to conform to social norms with respect to lawful behaviors. Repeatedly performing acts that are grounds for arrest. Example, engaging in theft, vandalism, or other criminal activities. Deceitfulness, repeated lying, use of aliases, or conning others for personal profit or pleasure. Example, frequent lying to family members and employers about their actions and intentions. Impulsivity or failure to plan ahead, making spur-of-the-moment decisions without considering the consequences. Example, sudden unplanned relocation or quitting a job without having another lined up. Irritability and aggressiveness, repeated physical fights or assaults. Example, frequent involvement in physical altercations or aggressive confrontations. Reckless disregard for the safety of self or others. Engaging in dangerous activities without considering the risks to themselves or others. Example, reckless driving, substance abuse, or unsafe sexual practices. Consistent irresponsibility, repeated failure to sustain consistent work behavior or honor financial obligations. Example, chronic unemployment, failure to pay bills, or neglect of financial responsibilities. Lack of remorse, indifference to or rationalizing having hurt, mistreated, or stolen from another. Example, showing no guilt after harming someone, instead blaming the victim for being vulnerable. B. The individual is at least 18 years old. C. There is evidence of conduct disorder with onset before age 15 years. D. The occurrence of antisocial behavior is not exclusively during the course of schizophrenia or bipolar disorder. Additional considerations: chronic nature. ASPD is a long-term condition, and the behaviors must be pervasive and persistent over time. Impact on functioning. The disorder significantly affects the individual's social, occupational, and interpersonal functioning. Differential diagnosis. It is important to differentiate ASPD from other personality disorders and mental health conditions that may have overlapping symptoms. Individuals with ASPD often exhibit a lack of empathy, inflated self-appraisal, and superficial charm. They may manipulate or exploit others for personal gain and have difficulty forming and maintaining relationships. Treatment can be challenging, but interventions may include psychotherapy, particularly cognitive behavioral therapy, CBT, and sometimes medication to manage associated symptoms such as aggression or impulsivity.